Okay, hi everyone. Welcome to webinar series Challenges of Expanding Access to Health Products in Fight Against Neglected Tropical Diseases. This webinar is organized by Japan Alliance on Global Neglected Tropical Diseases, JAGntd, and sponsored by Global Health Innovative Technology Fund, JHIT Fund. My name is Kota Yoshioka. I'm assistant professor at the Institute of Tropical Medicine, Nagasaki University. It's my pleasure to have you all today. This webinar series has discussed key access challenges in the field of NTDs. We had 6 sessions, and this is the last session. And in the last session in February, in the previous session in February, we explored patent pooling as a potential way to expand access to NTD products. The patent pooling has been successful for HIV and AIDS and COVID-19 as well. It may be applicable to some NTDs in certain circumstances. Now, let me ask my co-moderator Isaac what he found during the last session. Isaac, please introduce yourself and share one key lesson from the last session.
Thank you, Yoshioka-san. First of all, let me start by saying good morning, good afternoon, good evening to everyone, wherever you are. I'm Isaac Chikwana, the Director of Access at the Global Health Innovative Technology Fund. So for JHIT as a funder for innovations, we see intellectual property actually as a necessary incentive to innovations. And from the last lesson, we learned from the medicines patent pool that IP does not have to be a barrier to access. And they showed us the examples where this has been successful in HIV, hepatitis, and hopefully soon in COVID-19 tools. So it is possible. And we hope that more and more companies, innovators, product developers can engage with organizations like the MPP and really assess as much as possible how they can utilize the intellectual property like patents to the greater good in terms of access to medicines to people who need them. So for me, that was the lessons learned, that it is possible to use intellectual property for the greater good. Thank you.
Great. So IP can be a leverage. That's a great message. And this is my takeaway from the last session. I think patent pooling may work better when a market exists for generic drugs. And for many NTDs, the market is underdeveloped. So it's not clear who wants to buy drugs, how many, and how much. And without a good perception of a market, maybe patent pooling is not so useful. And the question of who buy drugs leads to today's topic, which is financing. Good. So, as I told you, this is a final session in our webinar series. And today we talk about financing. And I think this is the most challenging one and the most interesting one. So the questions that we want to address today involve: how do we get money to expand access to NTD products? And how do we allocate that money among different diseases or among different steps in the process to create access? Put simply, who pays for what? So this is literally $1 million question. And we don't try to answer it in today's session. This is a very big question. But at least we want to find a way to keep discussing. And for that purpose, we will visit a report published in 2020 about the landscape of financing for access to NTD products. This report was commissioned by the Uniting Effort for Innovation, Access and Delivery and written by one of today's speakers. Okay, so let me first invite Cecilia O from Access and Delivery Partnership, UNDP. She will help us to understand the context of the 2020 report by introducing the Access and Delivery Partnership and the Uniting Effort for Innovation, Access and Delivery. So please go ahead, Cecilia.
Great. Well, a good day to everyone. And thank you for the introduction, Dr. Yoshioka. I'm very pleased to be here to be addressing all of you. And it's a pleasure for me to start with the introductory remarks to the Access and Delivery Partnership. I think as many of you know, the Access and Delivery Partnership is an interconnected project with the JAGntd Fund. And I think as excuse me, Dr. Yoshioka says, we are working together and, also trying to untangle and unpack the issue of who pays what. So hopefully we might have an interesting discussion today. Let me share my slides now and we will start with this. Okay. So let's just go into it. I think this being the final session of the series, everyone should be aware of the challenges of the neglected tropical diseases by now. So I won't go into the details of it. Safe to make 2 points, which is that despite all the advancements in health, I think we still have a challenge of addressing neglected diseases. And there are two key points that I would raise. One, that the health technologies that are needed might still be unaffordable and unavailable. And this can be due to everything from bottlenecks within the innovation system. We talked a little bit about patents and patent pooling. There will be a situation if there is monopoly control or where the prices are too high, that would still be an issue in terms of access. There are also issues to do with bottlenecks within the regulatory, the procurement, and the distribution systems. So all of these may have a role to play in terms of getting access to health technologies needed for neglected diseases. And I think the one thing that the COVID-19 pandemic has also shown us, which is that to get the technologies that are needed, I think we are clear that we need health systems that function, that are resilient and robust to ensure that there is equitable access and the delivery of these medicines or vaccines and other health technologies that are required, whether it's to deal with the pandemic situation or whether it's to deal with the situation of neglected diseases. So this is where I think we come in as the Access and Delivery Partnership. And I think one one thing that I wanted to be clear in this presentation is to kind of describe the approach that we are taking as the Access and Delivery Partnership. First, just to say that we are looking at a partnership of 4 core partners, that is UNDP, WHO, TDR, and PATH. And I think what we try to do is to look at the national health system capacities in countries, and we want to look at it in an integrated fashion, everything from their policies to systems as well as the human capacities, because we know that it is a multi-sectoral and a coordinated health system that will be able to effectively deliver. So the ADP, or the Access and Delivery Partnership, now works in 9 focus countries: Bhutan, Burkina Faso, Ghana, India, Indonesia, Malawi, Senegal, Tanzania, and Thailand. And in all of these countries, we try to look at health systems capacity strengthening support in an integrated way. We also prioritize a South-South approach, where we take the implementation experience that we have learned in these countries to reach a broader group of countries that may well benefit from the lessons of our focus countries. Just to show you an example of what we mean by integrated capacity support. This is, what we call our access and delivery value chain. And essentially, I think it is to describe and to show that when it comes to access and delivery, we are talking about, a whole range of functions that would be needed. So even where new medicines, vaccines, and diagnostics are available and affordable, we still need to make sure that the regulatory system, the policy functions, the procurement and supply chain systems are working well. And then even at the end of it, that there is a safety monitoring or pharmacovigilance function that is robust and well-functioning to be able to ensure that there are no adverse effects of new technologies that are introduced. So essentially, it's a lot of functions and a lot of people involved if we are to have, effective access and delivery. Now, in terms of the strategy for the access and delivery partnership, I think we're very clear, especially now, that we need to build country platforms. So what happens within countries and within national health systems is extremely important. As I said before, multi-sectoral and coordinated. And I think this, is not just for TB, malaria, and neglected disease control. We have seen, as I've said before, that national responses to COVID-19 and, God forbid, future pandemics, all of these sort of responses will need a robust health system, and one that is able to deliver those essential functions that I've just mentioned. And I think another strategy that we've taken on is to try and see where it is possible to then include digital tools and solutions to help strengthen, the national health systems even further to be able to deliver the interventions that are needed. So at the national level, we think these are the sort of key priorities for us in terms of building these platforms. But also, I think at the global level, we think that there is a need for coordinated action. And this is the reason why the ADP, together with the JAGntd Fund and the government of Japan, have come together to bring to, well, I think we say we coordinate a global platform, but the idea of the global platform is to convene, the various stakeholders across what we call the innovation, access, and delivery continuum, to come together to figure out what is it that we need to do as a collective. It's creating the idea that there are common priorities and lessons that can be learned to resolve some of the bottlenecks that we see in access and delivery. And just very quickly to go through the goals, and I'm sure we will have an opportunity to discuss this further. But the idea really is to bring together the funders and the donors, the innovators and the PDPs who are looking at product development, who are involved in product development, but also to bring the access and delivery stakeholders together, because we think that this is the triumvirate that will be key towards resolving the issues of access and delivery. And, in terms of the approach that the Uniting Efforts platform takes, I think there are 4 things that we try to do. One, as I've said before, is the coordination, across the different sectors. It's also the integration. How do we have strategies that are able to address these different issues across the different sectors? And then how do we learn from each other so that we can come together for collective action? So, in a very short and summarized form, these are the sort of goals that we have for our collaboration within Uniting Efforts. And then just so that we have the context for today's discussion. And I think it's also very clear to the actors and partners of Uniting Efforts that there are certain priorities. And one, I think, and we will be discussing more of this, is how do we have, sustainable financing strategies for access to and delivery of neglected diseases? How do we also plan better for access and delivery within the research and development process? So I think, I hope that this, allows us the context that, we will have for our discussion earlier, which is essentially, we need to have maybe a better, I guess, thinking in terms of good financing and funding strategies. We also need to take into account the fact that when we talk about effective access and delivery, we are talking about a whole range of functions that need to be undertaken at both the national as well as the global level. And I think that sort of brings me to the end of what I hope has been 10 minutes. But I hope also that this gives us, sort of the context of why the ADP, the JAGntd Fund, and the government of Japan have come together, to convene the global platform for uniting efforts. And we are, of course, very pleased that Rohit Malpani is here to talk about the report that we commissioned, because we hope that the report has added to the discourse of financing for neglected diseases. So let me hand over to Dr. Yoshioka. Thank you very much.
Thank you so much, Cecilia. I appreciate that you made your presentation very concise and precise. Thank you. So now we understand the context of the report, 2020 report. Let me invite Rohit Malpani, who wrote the 2020 report. So Rohit will present this report, and I think this is very useful to review key elements of financing. So Rohit, please join us.
Thanks very much, and thank you for the invitation today and the opportunity to present the report. I'll just share my screen. So thanks very much for the invitation today. I'm really pleased to be able to run through this report and to then take questions. So just to note first on the methodology for the report, this was conducted in late 2019 and early 2020. So prior to the pandemic, and I think a lot of the conclusions and observations from the report are still relevant today, but I will try to take some time to talk about the challenges and I guess a few of the opportunities brought forward by the COVID-19 pandemic. This study was focused only on public sector interventions and investments that could improve access and delivery of health technologies. Certainly the research showed that there was a lot of private sector supply side interventions that are emerging and that are receiving increased funding, but we decided not to include those into the report, except for those that are ultimately adopted by the public sector. Now, it's important to establish a baseline as to where we are with health financing even prior to the pandemic, which is that, first of all, it is deeply inequitable. Most spending will continue to be in high-income countries through the next 3 decades, and this really reflects the trajectory of economic development between different countries. And this means, especially in low-income countries, that out-of-pocket expenditure ends up being one of the primary ways in which people pay for healthcare. And this can be very regressive, especially for people living in poverty. It can both contribute to people falling into poverty and can be a reason that people cannot escape poverty, whatever is the overall trajectory of economic development in different countries. And the COVID-19 pandemic has really required a lot of countries, both donor countries and low and middle income countries, to reallocate substantial amounts of funding as well as health system resources to address the pandemic. And I'll go into what some of the implications are of that. Now, even prior to the pandemic, many low and middle income countries already had a substantial debt burden that was making it difficult to finance basic interventions for healthcare. And we now see today, with spiraling food and energy prices due in part to geopolitical tensions, that this is going to make it even more difficult alongside the pandemic to be able to pay for the interventions that we know are required to address neglected tropical diseases. Prior to the COVID-19 pandemic, one of the positive trends is that we were seeing endemic countries starting to expand their investments into neglected tropical diseases. And this meant that increasingly these countries would not have to rely as much on donor assistance in order to pay for these necessities. However, there are some challenges. Number one, it is difficult to find any systematic tracking of such investment into neglected tropical diseases. So it's hard to know where progress is being made and sort of what is an effective mechanism for raising resources. Secondly, even when there has been budget allocations for neglected tropical diseases, often what we have seen is that these were either unspent or from time to time that these were shifted to other healthcare priorities. And it seems like one of the reasons for that is the perception that neglected tropical diseases, although they are a major contributor to morbidity, are not a major contributor to mortality. And so it leads to some reallocation that is not perhaps merited given the overall impact that it has on people's health and well-being. Now, also prior to the COVID-19 pandemic, it's important to recognize that donor assistance still played a very important role in paying for access and delivery to neglected tropical disease technologies. And I think the idea that donor assistance does not play an important role or was playing an increasingly smaller role was perhaps oversold as an idea. And what we see in particular is that for low-income countries, donor funding still represents a substantial percentage of the overall health budget for these countries. In some cases, it can be somewhere between 60 and 80%, and an increasingly smaller percentage for middle-income countries that are increasingly raising their own resources to pay for healthcare. Now, what we do see is that even if donor funding is a substantial contributor to health budgets, that the specific funding for neglected tropical diseases especially lags behind. We've also seen a decline in some donor funding for health and a narrowing of such donor funding to a smaller set of countries. On the other hand, what we did see prior to the pandemic is that some of the major multilateral funds that pay for access to treatment and delivery of treatment, such as Unitaid, the Global Fund, and Gavi, were providing more resources towards neglected diseases, driven in part by the emergence of new technologies that can improve healthcare. Now, it's important not to see the allocation of funding and financing as just being about donor governments and developing country governments. What we also know is that there is a large constellation of non-state funders and partnerships that also assist in the funding and financing of neglected tropical diseases. This includes development banks. It was started by the World Bank up to 2 to 3 decades ago, but we have seen the emergence of new development banks, especially situated in different endemic countries that are contributing towards access and delivery. There has always been a major role for philanthropies, such as the Bill and Melinda Gates Foundation, to help to harness their own resources, as well as the resources of both the public and private sector, to improve access and delivery of neglected tropical disease technologies. And that is reflected in different multi-stakeholder partnerships that have brought together these resources in order to expand access and delivery. We also know that there's a major role for pharmaceutical companies, especially through the provision of drug donations for mass drug administration. And some of these programs have actually been in place for up to 2 to 3 decades and may continue until there has been some of the goals around elimination reached. And finally, there is a role for non-governmental organizations and product development partnerships that often are responsible both for the development of these technologies and then to ensure access and delivery to some of the hardest to reach places around the world. Now to look forward in terms of what are the opportunities looking ahead, taking into account the COVID-19 pandemic. First of all, there is a potential for new donors to contribute towards access and delivery. And I think this is especially those countries that have a historical relationship to countries that have a large disease burden that see neglected tropical diseases as an important opportunity to be able to contribute towards better health. The BRICS countries have long been identified as a source of investment, partnerships, and leadership. First of all, that they are countries themselves that are dealing with their own burden of neglected tropical diseases, but also through their own responses and through their own learnings, can therefore be a source of resources and technical assistance to other countries. I think in the aftermath of the pandemic and with the tensions that exist today, there is a question that remains, I suppose, as to whether or not that potential will continue. But it certainly would be an opportunity, especially given the relationships that often do exist between the BRICS countries and low-income countries. I think it is also important to note that the COVID-19 pandemic has led many low-income countries, in my experience, to perhaps be turning away from some donor countries in terms of providing health investments and providing assistance. And this is on the basis of the fact that many low-income countries have been, in some cases, quite displeased around how technologies have been allocated around the world. And so one trend that we are seeing is that many low-income countries and even middle-income countries are trying to develop their own approaches to respond to health needs. And this really does come into then the opportunities around domestic resource mobilization. And what we know is that even though that there has not been as many facilities or approaches or mechanisms for neglected tropical diseases, there is experience in engaging in such approaches. Number one, we know that some low-income and middle-income countries develop what are known as earmarked taxes, which is that they try to allocate funding, let's say through a transaction on cell phones, on transactions on taxes on financial transactions or on sin taxes, and take whatever resources are raised through such taxes towards dealing with a specific health problem. Many more low and middle income countries, of course, are issuing their own loans. And these loans, for example, can be ones that try to aggregate the resources of their diaspora that therefore can be a source of stable income to be able to plan ahead and to be able to address some of their own challenges. There also has been the emergence of new catalytic funding sources to pay for disease treatment and prevention in low and middle income countries. And an important new entrant is the Global Financing Facility, which provides catalytic funds that then are matched by low and middle income countries to pay for new healthcare access and delivery. There also has been the emergence of what are known as debt to health swaps, which could be important today as we have seen such an increase in debt burden in low and middle income countries, in which a high income country forgives debts to a specific country, which then takes the savings from the interest payments and allocates that towards health spending. And finally, we have seen a trend of decentralization of healthcare in many low and middle income countries. And that means both regional governments, municipalities, and cities themselves are now paying for neglected disease treatment and access. There also has been an important increase in voluntary contributions in low and middle income countries, both from local philanthropists and from companies. We have also seen this continued use of consumer donations. The Global Fund started Product Red nearly 15 to 20 years ago, and that has played an important role in paying for healthcare access. And there are new examples that are emerging today. And finally, we all recognize that remittances have also always played the most important role in helping to pay for economic development in low and middle income countries. And the challenge is how to structure and harness those remittances towards structural goals and not just towards alleviating household poverty. As I mentioned, the study did not include private sector delivery of healthcare, but just to note that there are examples in which the public sector is paying the private sector, or is putting resources into the private sector to pilot new health systems innovations that are then transferred to the public sector. There also have been other mechanisms that have been used to expand private sector delivery, and I've mentioned some of these both here and in the report. And then finally, there are means to actually strengthen the ability of people to be able to pay for healthcare out of pocket where there continues to not be government resources, including the use of microinsurance or government-sponsored community-based health insurance, such as the case in Rwanda. Now, to come to COVID-19, again, we know that many economies and health systems have been severely affected by the pandemic, and this will have enduring impacts, especially for low-income countries that continue to be excluded from access to tests, treatments, and vaccines. And that means ultimately these countries will be unable to be able to address neglected tropical diseases until they can emerge from the pandemic. So we know that one of the most important ways to help countries address neglected tropical diseases is also to help them escape the pandemic itself. And the Global Fund 18 months ago had predicted that there would be significant setbacks towards addressing HIV, TB, and malaria. and many of those concerns have materialized. And even though I don't think there has been as much of a systematic accounting for neglected tropical diseases, we can assume that the impacts are the same, and in many cases, unfortunately, has wiped out nearly 2 decades of progress. We also know, again, that there are some trends in terms of the COVID-19 pandemic that will affect future funding of NTD access. We know that many donor countries have had to spend significant resources on addressing COVID-19, and therefore will have less resources to be able to provide towards neglected diseases. And the same goes also for low-income countries themselves, for voluntary contributions in those countries, and even for remittances, which have decreased dramatically during the pandemic. As I mentioned previously, there is a new historic lack of trust of countries due to vaccine inequity. And this will sort of lead, I think, to a greater assertiveness by low-income countries themselves to address their own needs. And we also know now that there is going to be this increased funding for pandemic preparedness and response that will come both from donor countries, from foundations, and from development banks. And the question is, will this actually have any relevance for neglected tropical diseases, or will they get left behind? And finally, I just want to end to point out that the report also dealt with efficiencies. So this is a set of interventions that can be introduced by low and middle income countries in partnership with donors and multilateral funds and development banks that can help to bring down the cost of access and delivery, and that can ensure that we are making the best use of resources, both from donor governments and from developing country governments and communities, to make sure that we reach as many people as possible. Thank you very much.
Thank you so much, Rohit. So we see that he put many of his thoughts into this report. And the point that you made about declining trust of donor countries due to COVID vaccine inequity, I think this is a very serious problem that we all might take into account. Great. So, Isaac, are you ready to start the discussion?
Yes, thank you very much, Yoshioka-san. Thank you, Cecilia and Rohit, for the presentations. JAGnt was involved in the development of this paper. So, but it's really interesting how we now have a pre-COVID world and a post-COVID world. So I'm not even so sure how much of what we did is still relevant, now. And you mentioned this, so I'll start my question with you. You mentioned how before COVID we were talking about increasing investments from domestic investments from endemic countries, which is what everyone has been pushing for. And if you look at the NTD roadmap, it's actually pushing for more domestic investments. And then the important role of donor funding. This was the status quo at that time, and we were hoping that this would continue. But now with COVID, everything has changed. We have seen how COVID disproportionately affected the traditional donor countries. But we also accept that these countries, and that they have the capacity to deal with epidemics probably more than the low-income countries, but that will have a dent obviously on how much they can donate to others. And you sort of mentioned that this needs to continue, but it's not so clear how this can be applied to NTDs. Will they continue being neglected as countries put more resources elsewhere? So my question to you is, what needs to happen now? Because we have post-COVID world, and we still have neglected diseases that are still neglected, and that will not change. We still need to deal with them. So what needs to happen now from what you've seen since we did this paper up to now, and where we're going?
Well, I'll give a first
answer. Maybe Cecilia can, okay. Yeah.
So I think a few things. I think first, number one, and I'll defer to Cecilia to answer this in greater detail. We still really need to understand what are the gaps and needs, and they need to be mapped out more and costed more, especially in a post-COVID-19 world for neglected tropical diseases. As I mentioned, the Global Fund has, I think, done a good job of trying to itemize and systematically identify these challenges for HIV, TB, and malaria. And I think to some extent, until we can identify the extent of the damage for neglected tropical diseases, we will be unable to therefore be able to really make the case for investment, both by donors and governments, endemic country governments. Quickly, I think two other things. Number one, for example, I think we are now in a period in which discussions are underway at the World Health Organization and elsewhere to define what we mean by pandemic preparedness and response. I think there are reasons to see why neglected tropical diseases are included in there, and of course reasons to not. But I think it is incumbent on us to not create artificial distinctions between what some countries perceive as health challenges versus what the reality is in low and middle income countries. I think there are also potentially new sources of financing. For example, with climate change, we know that neglected tropical diseases are only going to increase in due part to it, and we should see certainly addressing these diseases as part of adaptation to a warming planet.
Thank you, Rohit, for that. Cecilia, would you like to add?
Thank you so much. Maybe just to pick up the point that Rohit's mentioned about the funding for pandemic preparedness that we are seeing, although I think with the current humanitarian crisis that's also looming, we're hoping that there's got to be a balancing of those resources. But I think it's very important that we think about funding for pandemic preparedness in as broad a way as possible, because what is clear to us now, we know that when it comes to an effective pandemic response, we've seen this in COVID, and I'm sure we will see that in future pandemics, that it needs, and I keep saying this, a functioning health system. Where the health system is not able to function properly across the different areas, then we see the pandemic response either lagging or failing. And that is extremely clear. So when it comes to what do we need to do about pandemic preparedness and what are the things that we need to fund, we know for sure product development, the R&D needs to happen, but we also need to be very clear that when it comes to health system strengthening, that is part of the equation. And I think I would say as equal as in importance in terms of the equation. So the funding needs to be made available for this. And then just the same thing in terms of the climate change. Again, Rohit's mentioned that, obviously there will be health impacts and implications. We need to be able to kind of start thinking, what does the health system need to do as well? So when it comes to looking at climate adaptation or climate change funding, I think this is an opportunity for us too, to be able to then say, that definition of what needs to be done has to be a broad one, and I think this is the opportunity now for us. We also now have sort of emerging evidence or increasing evidence that when it comes to vulnerabilities of people with neglected diseases to COVID-19, for example, it's there. So when we think about how we want to structure funding and how we want to deal with both the product development R&D side of things and the health system side of things, then that has to be factored into the equation. So let me stop here.
Thank you, Cecilia. So you both alluded to this idea that we should not have this somebody else deciding what's the burden, who has the burden in what country. That's something that Rohit mentioned. Cecilia, you also mentioned that there should be more inclusivity in this pandemic preparedness discussions that we're talking about, to including even NTDs if it comes to that. So my question is related to something that also Rohit mentioned, like about the Global Fund and Unitaid also increasing their expanding their scope to cover NTDs as a way to sort of also provide this catalytic funding for NTDs. How do you see this going in the future? Because this has been said before. There have been, there have been a lot of voices to push for this. There have been some resistance for better or for worse. How do you see this now becoming a reality, now that we are in this situation where we need all diseases to be covered, because they are a burden, even if the funder might not think they are a burden. But there are endemic countries, there are people dying. There's more than 1 billion people being affected by NTDs every year. So they are a burden in some countries. So how do you see big funders like the Global Fund and Unitaid encompassing these diseases going forward? We'll start with you, Cecilia.
It's always the difficult questions first. I think it is incumbent on all of us working in the neglected diseases field. And I think for organizations and entities like UNDP, perhaps the responsibility is to be able to frame the discussions and the discourse in the way that we've just done, which is to say, we need a broadening of the approach. We've always said that, we can't work in, in a vertical way where we address diseases, in silos. So I think, the Global Fund has also, sort of shown that it doesn't work that way. So I think we're getting closer to the consensus that a disease by disease approach is not going to be as effective. I think that with COVID-19, perhaps that brings us closer together in terms of merging the discourse on neglected diseases versus, sort of epidemics and, emerging pandemics. But I think the responsibility now rests on all the stakeholders to be able to think that way, which is from the R&D side of things. We're also very clear that, we're not looking at developing one product for one disease. We're now looking at, platform technologies. So that needs to be thought through in terms of how this applies, not just to pandemics, but to neglected diseases. And then from the access and delivery point of view, I think the argument is clear that we are not looking at how do we address a vertical disease program. We're looking at overall health systems functions to be able to deliver everything from the policy aspects down to the delivery aspects, because it doesn't work that you have one regulatory system for one disease or one product. It has to cover all. So I think of course, I take on the responsibility of also trying to ensure that when I talk to not just the funders, but when we talk to government stakeholders, we need to try to make that as clear as possible. But not just by talking about this, but I think it's trying to put that into practice. We're trying to do that with the Access and Delivery Partnership, where we say, look, the regulatory system, for example, it's not just about getting approvals for one product or two. It is really trying to increase the capacity of that system to be able to do that evaluation and to ensure safety, quality, and so on for a range of products. And then that goes for everything that we're talking about in terms of the health system function. So I guess in short, I'm saying that we have the responsibility to try and change that discourse and to broaden it, to be able to make the case. Let me stop here.
Thank you, Cecilia. Indeed, one disease approach will not work, and you partly answered another question that came from the audience about having the one health approach. When you're talking about strengthening health systems, health systems should be able to handle whatever is thrown at them, not just one disease at a time. And if we talk of NTDs, I mean, we're adding 20 diseases already, which are high priority, and there is even more than those 20 actually. So no, that's a very interesting response. Thank you very much. Rohit, would you like to add?
Yeah, sorry. So just quickly, I mean, there were a couple of examples, prior to the pandemic. You had Unitaid adding in Chagas, for example. You had Gavi starting to consider introduction of the rabies vaccine. in some ways, echoing a bit on the last question, one of the things that we're seeing now with the major global health funds is that they've all sort of identified pandemic preparedness and response as sort of one of their main areas of focus. On the negative side, again, that the question is whether or not that will sort of explicitly exclude the diseases that we are here to address. And so again, I think some of these conversations that are at the normative level that are trying to define the scope of pandemic preparedness and response then flow down to the specific decisions that these different financing instruments make. On the positive side, what we do know is that many of the functions in pandemic preparedness and response relate across the board. So the key is really to try to think about how to apply these as broadly as possible, even if they're nominally meant to be preparing for a future pandemic. And I think this is still an opportunity now, in a sense, to build a better pandemic preparedness system going forward that isn't so narrowly focused on what has emerged from COVID-19. I think there's also other ways in which multilateral funds can engage. I mentioned just very briefly at the end the different efficiencies that can help to bring down the cost of access and delivery. And in reality, that's a lot of what the different global health funds are focused on today. They are increasingly less involved in financing healthcare systems and more involved in many of these efficiencies. So I think it is not a bridge too far to consider how to make these investments into the NTD space in a way that would be, very additive towards the overall response. I think the other thing is what we're seeing, for example, with COVID-19 is that there is a need now to scale up testing and treatment for not only immunization. And we recognize that the only way to do this in all countries is through a health system strengthening approach. It's not through a vertical approach. And so I think that in many ways can help to also inform some of the investments that can be made to address NTDs. We know now, and I didn't cover this in the presentation, that we are evolving from an approach to NTDs from mass drug administration and elimination into much more refined test and treat strategies. So we're going to need these health systems investments, as Cecilia was saying, to ensure that we can actually reach people with these new technologies.
Thank you. Thank you. I like that you used explicitly exclude, if these discussions are going to explicitly exclude. That actually, brings a point that there is a decision, a conscious decision that is being made to exclude these diseases. And that's probably where we need to change the rhetoric, with in line with what Cecilia was saying, that it is really up to us to find ways of how we can change this rhetoric so that these diseases are included in all these discussions about pandemic preparedness, about global pooled funding for interventions. So thank you very much for those answers. Yoshioka-san, do you have any questions from your side at the moment? I have one more question specifically for Cecilia, but I'll give you the floor for now.
Okay, so yeah, I wanted to discuss a little bit more about the domestic resource mobilization, which is also pointed out from the audience. So my question is that promising? So as Rohit said, some countries rely it's 60 or 80% of funding to donor countries. And can we really get more money from the endemic countries?
Well,
before you answer, Rohit, let me just add to that question. So maybe could you also define what you mean by domestic financing? Who exactly is domestic? Is it the government? Is it private sector? Is it philanthropists? Who is domestic? Thank you. Sorry for the interruption.
So yeah, I'll start maybe with Isaacs and then come to the broader question. So from my perspective, domestic resources is of course about governments, but again, there is a expansion now from not just a national government or federal government. With the decentralization of healthcare, you're seeing much more financing being raised by municipalities, by cities, and by regions. Kenya is a great example of this, in which they've, and Indonesia has explicitly tried to really push as much of the funding as possible to the local level. there is increasingly, again, I consider remittances to almost be, in a sense, domestic funding, in part because even if it is coming from overseas, it is very tightly tied to household spending in many countries. We also know, again, that there's significant increases in both corporate wealth and individual wealth in many low and middle income countries that really provides opportunities for philanthropy and for voluntary commitments. And then finally, that countries themselves can issue loans that can then be used to actually help to finance many of these NTD investments that are not a cost. They are an investment. They provide a return. They lead to economic growth. So these are really ways in which you can expand funding and financing in an effective manner. In terms of the optimism, it's again, there's two sides to that. There is the recognition today that many countries are facing, again, this collision of different crises of COVID-19 and of these really significant increases both in food and energy prices that is going to make it hard in the short term to raise additional resources for these priorities. But in the medium to long term, we know that there has been many examples of countries being able to, again, earmark taxes to be able to raise resources that go directly into these specific priorities that are identified and that are in a sense then removed from the to and fro of budget allocations on an annual basis. And we ultimately know that just as in our own countries, it really is, it's a function of politics. It's a function of raising awareness. It's a function of making the right case. If the right case is being made, if the right people are bought into these investments, then those will happen. And again, I think in some ways we should not distinguish between what it takes to increase resources for whatever are the major contributors to morbidity, mortality in Japan or in Europe or elsewhere, as it is in many that are facing the highest burden. And the last thing I'll say is, what we have seen on the front end over the last decade is many BRICS countries, especially that have had more resources, have moved these into neglected tropical diseases. It's been identified as a priority. And I think the assumption we can also make is that economic growth increases once again in a lot of other countries, that the resources can flow into those priorities. Over to Cecilia.
Thank you. Cecilia, you wanted to add?
Not just to say that I agree with Rohit in terms of, I think, a healthy dose of optimism that there will be opportunities to mobilize domestic resources. And I think one of the things that we are trying to do also, and this is, part of ADP and JAGntd Fund and the government of Japan, coming together with the WHO NTD department, is to build investment cases for governments to think about, the feasibility and viability of domestic allocations and funding for addressing NTDs. I think, for a long time, it was just, of course you have to do this, but I think, we need to build that evidential basis for it to make sense for governments to think through this carefully, and then to be able to think of the tools and the different, opportunities for resource mobilization at the national level. I'll just stop here.
Thank you, Cecilia. So my last question to you is more about oh, Cecilia has disappeared. To ADP focus countries. There's a question from the audience about how do you select these countries? We have had these discussions before, but I guess for the benefit of the audience, could you just elaborate on this process?
Absolutely. I'm sorry, I just had to plug in my laptop. So I might have missed the first part of the question, but if I understand correctly, it really is a question of how do we pick our countries for the ADP? Well, hello there. We have a criteria that we set out, and I think it links, everything from disease burden of the various diseases that we're looking at, to looking at the sort of the existing sort of government, political willingness, the existing framework that is available to address, the health system functions. And to be quite frank, I think, the existence of partners who are willing to champion the work that we do. I think what we find to be extremely important for the ADP is to find the willing partners to be able to do the work, to show the results, and then for us to then demonstrate that it is possible and it is effective, so that we're able to convince other governments. So, a long story or a long answer made short is that we have a criteria that looks at everything from disease burden to existence of partners to the current political willingness to take the sorts of actions that we need to take in terms of health system strengthening. I hope that answered the question, Isaac.
Yes, thank you. I mean, for me, it answers the question because we've had this discussion before, but I hope for the audience, you've understood how the ADP selects these countries. So unfortunately, as always, we're running out of time. So we have 5 minutes left. I'll give the floor back to Yoshioka-san for his final questions and to wrap up the session. Yoshioka-san.
Okay, thank you. So just a quick final question from me. So I agree that the global health trends now is against siloed approach, against vertical approach, against disease-specific approach. And more people are talking about that integration to pandemic preparedness as a health system is important. But taking very extreme position, NTD never causes pandemic, and NTD often drops from the priority within the health system. So I'm a little bit skeptical when we talked about this kind of horizontal approach. What do you answer?
I can go first. Look, I think on the one hand, there is a difficult case to be made for certain NTDs to be viewed within the rubric of a pandemic. But I think it is really incumbent on donor countries themselves and on the endemic countries to be clear that it won't make sense to put such a significant amount of resources towards future planning for pandemics that in many respects is not meant to be used, right? That in many respects is meant to be for preparing for something in the future. It is certainly the reality today with many countries that continue to be under vaccinated or unvaccinated or do not have access to testing, that are actually still much more focused on these neglected tropical diseases. That is the daily reality that has to be faced. So I think it is really a necessity that therefore for all of us to be able to look at the investments that are going to be made to make sure that they are drawn as broadly as possible to not exclude all of these other interventions. And especially as we start, for example, to building out a COVID-19 testing and treatment response, to recognize that that actually, again, cannot be done in a vertical fashion, and it offers an opportunity to be drawn as much as possible. There are many lessons to be learned from the last 2 decades with HIV, TB, and malaria, and for all of the successes involved with it, these were highly verticalized approaches. And I think maybe to some extent, we have to start by examining why those did not, why they were not as inclusive of some of these other priorities, and to learn from that, and then to apply those lessons towards this upcoming, infusion of resources for pandemic preparedness.
I don't have too much to add except to agree with Rohit. I think, the neglected diseases are not called neglected for nothing, but I think the fact that we are coming together to discuss this is a cause for optimism. If we're learning anything from, I think the gaps and the failures of the COVID-19 responses, then, we know that, vertical siloed approaches are not effective, and it is going to be a drain on resources, and it's not going to, work towards efficiency or effectiveness. So I think, if anything, we will need to make that case to provide the evidential basis that it doesn't work, and convince donors and funders as well as governments that the resources should be put to good use and should be used in a way that is, as we are saying, defined broadly to cover health systems approaches that will address pandemics, epidemics, and the neglected diseases that we're talking about.
Okay, great. Thank you so much. So I think we addressed many difficult questions today. Thank you. So unfortunately, it's time to close today's session. And today we talked about financing, about access to NTD product. So Cecilia and Rohit, thank you again for joining us today. And I think many people are asking where is Rohit report. So I will share the link after this webinar session. Great. So with today's session, we complete our webinar series discussing access challenges in the field of NTDs. And I hope this series has been useful and helpful to think clearly about access, which is a very complex matter. And to close this webinar series, I'd like to extend my thanks again to Isaac as my co-moderator, JAGntd Fund as a sponsor of this webinar series, and everyone who attended our sessions. Please feel free to reach us to share your feedback and your ideas about next steps that we may take together. Great, everyone. Thank you so much. Bye-bye.